Hey everyone, welcome back. Kurt Bart with Encore Physical Therapy, and today I want to talk to you about a very common injury, especially that occurs this time of year when the weather gets better and outdoor activities and sports are picking back up, and that is ankle sprains. So today we're going to talk about initial treatment of the first day to 10 days of the injury. So a sprain occurs when a ligament is stretched or torn, and it could be anywhere from a micro tear to a complete tear. In particular with ankle sprains, the most common ligament that is injured is the anterior talofibular ligament, or the ATFL, and it attaches from the outside of your ankle to just in front of your foot, and it sits like this. Now, the reason it is the most common injured ligament is because the ankle sprain that is most common is an inversion sprain, which means the foot turns inward like so. And so if you can picture, if the foot is going in, the insertion point of this ligament is being stretched away from its origin, and so it will stretch out and lengthen and possibly tear. So what do we do for treatment of an ankle sprain? Well, initially, what we want to start with is the RICE technique. Now, RICE stands for rest, ice, compression, elevation. So to start with rest does not mean immobility. You can still get up and move around as needed, but a lot of times you're going to need crutches. So I want to talk to you about proper crutch adjustment and proper crutch use. Now, as a physical therapist, I see patients come in all the time where crutches are not proper height or adjusted the way they need to be or being used properly. So what you want to look for when you're using crutches, initially for the height, you want to make sure that you have 2 fingers distance between the top of the crutch and your armpit. So if you put that right next to you, you can see I should be able to fit 2 fingers right under there, okay? Next, for the grip, you want to make sure you have a slight bend in your elbow, and the way that's going to happen is by lining the grip up with just above the wrist bone here, there's a little bump, and that's where you want to put that. So as you can see, if I just relax my arm down by my side, that grip hits right there, okay? So that gives you just a slight bend in your elbow. Now, we're going to pretend that my right foot is the sprained foot or sprained ankle. So you want to make sure that you hold it off the ground, okay? You can do little weight through your toes for balance if need be, but ideally, if you're able to keep it off the ground. As you advance forward, you can do 2 types of gait. There's a step 2 and a step through. A step 2 gait means that you're bringing your weight-bearing foot to the crutch. This is a good way to start, especially if you've never used crutches before or you feel really off balance. The next one is a swing through gait, which means you're bringing your foot all the way through. As you get more comfortable, you can start to use this one. It'll get you where you need to go quicker and more efficiently in a step 2. So now I want to talk to you about compression. The reason that we want to do compression is to reduce swelling and edema in the foot and ankle. The best way to do this is with an ACE wrap. You can also acquire neoprene socks and compression socks from local pharmacies, but sometimes those are hard to find. ACE wraps are generally easier and more common. And the way that you want to apply the wrap is through what we call a basket weave technique. So I'm going to show you that right now. You're going to take your wrap, and we all know that it has a lot of stretch. We don't want to put max stretch on it. We want to do about 50% to start, okay? And we're going to reduce our compression as we move up so we can make sure that we have more pressure at the furthest point in order to push that swelling towards our heart and get it back in our system, okay? So you're gonna take your wrap and you're gonna start just below the toes, okay? And you're gonna do an initial wrap right around, okay? And that's just to stabilize that end. Now, from this point, what we're gonna do is basically a figure 8, okay? And so as you can see, I'm coming down at a diagonal, and then I come up from the bottom of the foot, and then I come back up. So I'm kind of making an X here, right? That way, and then that way. And then as I come back around the bottom of the foot and come down on my diagonal, I'm cutting my initial wrap in half. So as you can see, there's my initial there, and the edge of my second layer is basically cutting that in half. And you continue this way up the foot and ankle, okay? And so if you're doing it properly, you should have a zigzag pattern, just like so, okay? Now as we go up, again, we're going to reduce our compression, and make sure that you're rubbing out any of the wrinkles if you see them, because you don't want to irritate the skin and create extra pressure in certain areas that could irritate and cause sores. So as you can see, just gradually reducing my stretch to where I basically have no stretch right now. And I'm just covering up as many layers of, just covering up the foot and making sure that the skin underneath is covered. And then you just pin it down. Lastly, I want to talk to you about ice and elevation. These are very simple concepts, but a lot of times done incorrectly. And the reason we want to do these steps, again, is for overall reduction of swelling in the ankle. Now, the purpose of ice is constriction of blood vessels. So if you have smaller vessels, there's less fluid that can get to the foot or an ankle. Elevation we use because generally to get blood and fluid back into our system, we use muscle pump techniques. And that's contraction of our lower leg muscles help pump the blood and fluid up our legs. But since we're resting, we are unable to do that. So we want to use gravity to our advantage to help get that fluid back into our system so we can expel it. So common mistakes I see with these two steps is using ice for way too long and improper elevation. The foot is too low. So in terms of ice, I like to use a gel pack because it forms around the surface that you're trying to ice better than just a regular bag of ice. It's a little bit more malleable. You can also use a bag of frozen vegetables, peas, corn, something small that will be able to maneuver a little better. And what you want to do is you want to keep the ice on for about 15 to 20 minutes at a time. Now you can take it off, let your foot and ankle come back up to temperature, body temperature, and then reapply the ice. But the reason you don't want to go longer periods of time is because the body can sense that as hypothermia, and what it'll do is it'll actually rush blood and fluid to the area to warm it back up, which again will kind of increase swelling, which is what we're trying to reduce. Now, this can be done in conjunction with compression and elevation. The most common mistake with elevation is people just think that propping your foot up on a surface is elevation. But really, again, what we want to do is have the fluid go back towards our heart, because that is the muscle that is pumping everything around. All the fluid to get into our liver and kidneys and lymph nodes to be filtered out, okay? So we want the foot to be above the heart. So the best way to do that is lie down and put your foot up on some pillows or the side of a couch, or if you have a wedge, you can do that as well. But as you can see, if I lay down here, It doesn't have to be way above my heart. It just has to be slightly. And so, as you can see, the foot is above my chest, and gravity is gonna help pull fluid into my system so it can be expelled. Okay? Thanks again for watching our video today. Again, the focus was the initial 10 days of an ankle sprain and how to treat at home. It is always good to see a physician or go to urgent care if this does occur, just to get checked out and make sure that you don't have any serious tears or breaks. Our next video is going to concentrate on what to do after the initial 10 days in order to regain strength and mobility in your ankle. Give us a thumbs up if you like what you see. Don't forget to hit that subscribe button so you don't miss out on any future videos that we come up with. And have a great day. See you next time.